Hi, I'm Dr. Duncan Pelly, aka Dr. D.
Hi, I'm Princess Gaia.
I'm Julie St. John, and I'm an associate professor with Texas Tech Health Sciences Center, the Department of Public Health. I have been working in public health for a little over 20 years, but that wasn't my original intention. I thought one day I would go to medical school, and kind of in that process, after I graduated from undergrad, worked at a college and was kind of working towards going to medical school, and attended seminary, and I did a degree in cross-cultural communications. And as part of that, I was able to travel. I spent a couple of 6 weeks stints in China and other places, and got to visit a lot of different countries and do some international work. And while I was doing some of that exploratory work and research in a different field, I really started to see the need for public health interventions. I really became interested in how you engage and impact change at the community level. And so I then went to Texas A&M. It was in the School of Rural Public Health, and I obtained a master's in public health and epidemiology and biostatistics, and again was able to do some work internationally in the Dominican Republic. I did a lot with teen pregnancy and working with the community health worker model, and then I continued to work for Texas A&M for several years. At that point, I decided I really wanted to pursue public health, and so I worked for Texas A&M, basically almost as a community organizer. And so we would go into communities by invitation, and we would help them assess their community. So what are your strengths? What areas do you seem to be struggling with? And how do we work with communities, not do the work for them because that's not sustainable, but really just helping them identify how to address an issue and working with them. And somewhere along the way, I picked up a doctorate in public health that really focused on behavioral health and how do we get people to engage in behavior change that's sustaining, all the while still working with communities to build their capacity. And so I've now been with Texas Tech for about 6 years, and I've continued that sort of work. People ask me, well, what's your topic or your discipline? And I really do community-based or community participatory-based research that works on building capacities of community to affect change. So that's what I do. So I cover a lot of topics. I do anything from water to asthma to heart disease to all sorts of things, but it's all with the intention of working with communities in behavior change and sustainability.
Is there some sort of an interesting story that led you to choose public health?
Yeah, so I was backpacking through the Himalaya mountains, and we were doing GIS mapping in a southern part of China, and trying to identify where indigenous people groups were in China. So as you know, China has over, a couple hundred people groups, and 92% are what they call Han Chinese, but we were trying to identify and work with the Naxi people. And it was during that experience, we literally, had backpacks on our, backs, and we went through the mountains and trails, and it was a great experience. And we would come upon these villages. And as we came upon the villages, we literally would just knock on doors. I didn't speak much Chinese at all. We did have a translator with us, and we would just ask, hey, can we pay to sleep on your floor tonight? And that's where I learned how to kill chickens and dip them in boiling water and fix our meals. And as I did this work for about 6 weeks, I really started to notice just some of the disparities, and that was there, and it's everywhere that we go, and really became interested in how do people change if they want to. And so that's where it kind of led me to public health, and how do you assess populations and behavior change, and what is epidemiology, and how do you track what's going on. That one experience really is what drew me to public health and made me seek it out. I didn't know it was public health at the time, but when I came back and started having conversations with people about my interests and how they were changing, they said, oh, you need to go into public health. All right, so today I wanted to visit with y'all a little bit more about the importance of water, and y'all have been talking about this in your storying group. And just want to talk further about it from a public health perspective. And that really brings us to, well, what is public health, right? And most people think, well, it's tracking diseases right now with the COVID-19 virus. It's that, right? That's public health. And I say, yes, absolutely. And kind of the technical definition of public health, it's ensuring conditions in which people can be healthy, right? So it's pretty simple. It's helping people be healthy. And that involves, you have to identify what those threats to health are. Right now it's this virus, and then combating those threats, trying to prevent those threats. That's what public health is. But I really take it a step further, and my definition of public health, as I tell people, public health is really anything that has to do with our basic human rights. Air, food, safety, shelter, water, right? Everyone, in my opinion, and I believe you all share these values, should have access to those basic essential needs, regardless of where you live or who you are or your education, right? Everyone should have those basic rights. Public health has everything to do with that. And it really encompasses this broader definition of health, not just the absence or presence of an illness, but it really encompasses the emotional, physical, spiritual, mental well-being of a person. So that's what public health is. It's helping people be healthy holistically, a broad view of that. Every public health professional is going to be involved in assessment. That's the first one. And that's just, we have to know what's going on, collecting data, analyzing data, distributing information, assessment. And then assurance, it's access to health and healthcare. And the last one is policy development. What are those policies and rules and regulations that we can do to make life more healthy for everyone? And then again, just the core purposes of public health. Well, we want to prevent epidemics, pandemics, and the spread of disease. Again, what a time to be in public health right now. One of the worst pandemics we've seen in over a century. And then we want to protect against environmental hazards. We want to prevent injuries. We want to promote and encourage healthy behaviors. And we want to respond to disasters, assist communities in recovery. And then also just this quality and accessibility of service is another key part of public health. So why water? Well, I want to share a quote with y'all from the United Nations. They had an Action for Water conference because I think it's so great. So this is what it says. It says, water is at the core of sustainable development and is critical for socioeconomic development, healthy ecosystems, and for human survival itself. It's vital for reducing the global burden of disease and improving the health, welfare, and productivity of populations. It's central to the production and preservation of a host of benefits and services for people. Water is also at the heart of adaptation to climate change, serving as the crucial link between the climate system, human society, and the environment. And we all know that water is so critical to everything that we do. And about 3% of the Earth's water, is my understanding, is actually drinkable water or usable for other purposes. And just a few things, facts about water. Right now, there's almost 2 billion people who live in river basin areas globally where water use is more than the recharge of that water source. So we're exceeding the use there. The global demand for water is expected to increase by 55% by 2050. And that's not that far off. 2+ billion people experience water stress, meaning they don't always have access to enough water or safe drinking water. The economic loss in those areas where their water stress is 1.5% of the gross domestic product in those countries. 80% of our wastewater is discharged without any treatment, and that really can lead to some diseases and poor health outcomes. Water-related disasters just since the 1990s, it's affected more than 4.5 billion people. So more than half the world's population has been impacted by a water-related disaster with more than $1.5 trillion in damage. And then just one that to me is so sad is there's 3.4 million deaths, and that was the number in 2018 from waterborne diseases. And these are treatable, preventable, or I should say they're preventable if you treat the water. 3.4 million deaths, and a lot of those are children. So that's just some of the things that public health looks at those numbers and says, man, water is really important. We got to address this because it's impacting our quality of life and even the ability to live or die. Right now, water guidelines are fragmented. There's all sorts of entities that address different components of water. How much water you can use, the type of treatment that has to go, the type of services, all these things seem to be fragmented. And public health really tries to take this holistic approach when we're talking about, for example, control of pathogens. we understand and we promote that you have to integrate across all exposures of pathways, right? There's a whole host of potential entry of pathogens into a water source by the time it gets to someone's cup that they're drinking. And this integration really occurs at two levels. So there's what we would call proximal factors, and those are things that usually on the forefront of people's minds when we talk about water, and that's things like water quality, sanitation, hygiene. Those are proximal factors that we think about a lot with water. The other side that we don't think about too often are distal factors. And what do we mean by that? Well, those are those social determinants. Where we live, our age, our gender, our race, our education level. Those also impact water. And a lot of times, public health is so concerned about this because we might do fairly well in trying to address those proximal factors, but those distal factors, sometimes they're much harder to address. And I like to tell people the story of, if you go back to public health and some of the key roots, and you had the cholera outbreak, right? The famous London water pump handle, and everyone knows that John Snow, right? He was the one that figured it out. There was his other air miasma theory particles, but he said, no, they mapped it out and they figured out, actually, it's the water. He figured out the proximal factors, right, that were causing the cholera. But then you had someone else, and I'm always surprised by this. He's a little less well known, but Edwin Chadwick, at the same time, he was looking at this and he said, well, yeah, absolutely. But he pointed out that there are a lot of social factors that were involved in this. So the outbreaks were happening in poor communities where they lived a lot closer together. They didn't have the same type of access. And so he was the one that said, there's these social factors or these distal factors as well. So how do we take a public health approach then to address both proximal and distal factors? Well, one, we have to have surveillance. We have to be able to measure what the risks are. And then we have to be able to compare the measured risk to what's an acceptable level of risk so that we can identify and implement control strategies. And then those lead to interventions. And there's kind of four key categories of interventions in public health. One is our preventative medical care interventions. Another level are health education and behavior modification, which is what I work on a lot, and those tend to address more of the distal factors. Then you have environmental control interventions, and those are looking at those more proximal factors. And then lastly, policy or political will and advocacy. And again, those tend to be more distal factors and how those impact policies in health. Well, we have what we call some guiding principles. So let's talk about some of those. So one, in public health, we really promote that something must be multidisciplinary, right? You can't just have the water treatment person there. You need everyone at the table, right? You need the people using water. You need the farmers at the table. You need industries at the table that use water for different things. You need everyone at the table, multidisciplinary. Second, it has to be participatory. And what do we mean by that? Well, what we mean by that is not just, hey, come sign this, signature or petition that we need to address the water issue, and then they leave and they're gone. No, it's inviting them to sit at the table and to be a part of the conversation, actually coming up with whatever solutions might be possible, and then carrying that out. That's how you really get buy-in and sustainability. It has to be equity focused, right? We have to give everyone that opportunity to be at the table, and it must be equitable. No one is any higher or any lower than we're all together trying to figure this out. Public health also says it has to be qualitative and quantitative. So what do we mean by that? Well, the qualitative, as my friends here today, they love that, right? Because they're storytellers. That's what we do. And there's so much richness in qualitative data because there's things that you just can't capture with a survey or number counts, right? You just can't capture what all the problems and the successes are necessarily by numbers. So it takes both. And public health says you've got to collect both types of information. And then multiple methods. Don't limit yourself to just one. Be open to lots of different approaches. And in fact, one of the biggest models we use for addressing public health issues, the social ecological model, does just that. It looks at the individual, and then it goes the interpersonal, and then there's community, organizational, all the way up to the societal level. That's what we mean by that. You have to be open to lots of different methods in order to address something holistically in the best approach. And then lastly, it has to be open to public scrutiny and feedback. We can't be territorial and we can't be offensive if someone says this isn't going to work. And I was at a training in South Texas in some colonias, which are kind of unincorporated areas, and have some infrastructure issues, running water, electricity, some of those things. We were working on environmental issues, and we were talking about the different environmental pollutants. And one of the stories that came out of that I'll always remember, and it's just an example of how we have to keep an open mind, was there was a little girl that was brought into one of the federally qualified health clinics, and they kept seeing her repeatedly, and she had horrible skin rashes. And they ran every witch test. I mean, they did everything. They tested her for allergies. I mean, just, all sorts of things. And this went on for months. And just that whole process of trying to figure out what it was. Well, one of the community health workers that I worked with, and they call them promotoras in South Texas, she was part of the team, and they would do home visits. And she said, well, would it be okay if I went home with the mom and just observed? And so the promotora, the mom said, sure, was very open to that. And the promotora went and spent the day with her. And very quickly, one day was all it took to figure out what was going on. The mother was from another country and had seen bleach and knew that bleach was used to clean and sanitize. Yeah. And the mom did not have a lot of resources. And so the mom was putting about 2 cups of bleach and about this much water in a bathtub and washing her little girl. And the bleach was causing all the problems. And so the community health worker said, oh, let me explain what this is used for. It can make water clean for drinking, but this is how you use that, but for baths. And of course the mom was mortified, didn't realize it was just something she had access to and it was cheap. And so, she was told as a cleaning product, so that's what she was using it for. But I think that's something, it's just, I always remember that story because all the expertise in people that were in the clinical setting, it took someone going to the home and observing and being participatory and identifying an issue, and it was a really easy, low-cost fix, and the problem went away and the little girl's healthy. And so I don't know if that's exactly what you're asking, but I think it's such a story that has always reminded me when I think I know something, I realize I really don't. And this is this whole approach of public health where we need to bring everyone at the table, even if we think they may not have something to add. I've really learned through the years that everyone has a story and a value that they bring to the table. Yeah, I think the parting message I would just leave is that what I enjoy is helping people, communities, because that's what public health really is. It's that ability to solve problems. And I love it because there's always, usually the solution is not the first one that comes to mind. And so to me, it is a challenge, and I love that ability. And this whole pandemic, I think, has created opportunities. And I think at first people, it's scary and it's different and it's new. And one of the things that has stuck with me through this is I love all the innovation and creativity that I've seen coming out of this and the good that it's bringing out in people. And I think it's drawing a sense of community, which sounds kind of counterintuitive because we're locked apart from each other. But I think it's really drawn people closer in some ways, and it's not without its challenges, but I think it's required innovation and creativity. And that's been something that I've loved seeing coming out of a public health crisis, to be honest. But it's also, I think, going to lead to things in the future that are going to benefit and improve everyone's health. So thank you for asking.